okay, and I would just like to start by thanking Caabu, the Centre for Arab British Understanding, for being the Secretariat of our all-party parliamentary group on Palestine, and really being the locomotive of the work that we're doing to bring the issue of Palestine and the Israel-Palestine issue as far up the agenda as we possibly can here in our Parliament, and to really do so in a cross-party way. The all-party parliamentary group is very much a cross-party initiative. I'm the co-chair alongside the Conservative co-chair, who does great work on this issue as well. And we are very, very honoured today to have an amazing panel who are going to talk to us about the issues around medical and health challenges that are being faced in Gaza and the West Bank. And it's a huge honour to be able to hear directly from people who really are on the front line of this issue, and also I think to talk a bit about the potential knock-on impacts of the pandemic in the region and in the occupied territories, so that we can get a better sense of what all this means, particularly as, of course, the focus will continue to be on the possible illegal annexation of the West Bank that's being pushed by Donald Trump and Benjamin Netanyahu. So we do very much look forward to hearing what our colleagues have to say. I don't know whether we've got a speaking order, but I'll introduce just at a very top level who our speakers are, and then hand over to whoever would like to start. So we're very pleased to have Laila Barhoum of Oxfam, to have Abbas Melhem, who is of the Palestine Farmers Union, and Fikr Shaltoot, who is based in Gaza and the director of MAP in Gaza. So we really do look forward to hearing from you, and I would like to hand over to you. I'm not sure, Joe, who we think should kick off, but you know, that's over to you to decide. And many, many thanks for today.
Should we kick off with Fikr?
Well, yeah, maybe just start off with, yeah, go ahead.
Fikr, is that all right?
Yeah, sure, thank you. So thank you, Stephen, Joe, and Yasmin. I'm really glad to be speaking to you in the UK and have this opportunity to highlight the situation in Gaza. So if you allow me first, I would like to just, you know, describe Gaza in general. It's a very small area in Palestine that is only 365 kilometers, inhabited by 2 million people. So the population is like 5,500 inhabitants in each square kilometer. 68% of the population are food insecure, and they live under a blockade since 2007. The unemployment rate is roughly around 55%, and this is among young people, reach around 70%. The population in Gaza suffer all the time from electricity problem, deficit that have impact on the healthcare situation, the water and sanitation in Gaza, and the groundwater. Actually, 96% of the groundwater in Gaza is unfit for human consumption. So with regard in addition to that, actually within Gaza, as you know, the security situation is unstable, and there is always spikes of unpredicted spikes of escalations that happen from time to time. For the last 2 years, for example, there was the Great March of Returns demonstrations that left more than 34,000 of injuries. Of these, more than 1,200 people with very complicated injuries that need long-term treatment and complicated surgeries of limb reconstruction, neuro, etc. In addition to that, unfortunately, the political divide between the West Bank and Gaza have significant impact on the socio-economic situation, the health situation, the healthcare, the health workers' salaries, people being, not receiving their full salaries, etc. Also, when Trump took the decision of cutting the fund for the UNRWA and also the US-funded organizations, many of the projects and activities that were supporting people in Gaza also, people have been deprived of this and has contributed to even further deterioration of the economic situation within Gaza. With regard to the health, actually, as I mentioned, the situation in Gaza is stable, so people live in a protracted emergency. And actually the situation, the health system was described by the UN as, that was on the brink of the collapse. And this is even before the start of the pandemic of Corona. The Gaza health system has been lacking the adequate medical supplies of essential drugs, actually, and we're talking about essential supplies, medicine, and the medical disposables. The shortages over the last few years was 30% roughly. I'm talking about rough figures, but it was roughly 30% for the medical disposables and 40 to 50% for the medicine, the drugs items. We have reduced the number of personnel, skills, and motivated health workers. Given the long-term blockade since 2007, the health personnel are not receiving, opportunities for building their capacity or, and not receiving their full salaries, and they are not in contact with the, their colleagues elsewhere in the world. So unfortunately, in the last 2 years, more than 100 of the very skilled personnel, including medical doctors, have left Gaza for good, and they are not returning, seeking opportunities elsewhere. There is enormous rise of trauma casualties, as I mentioned, and this is due to the great march of return, but also to the ongoing escalation happening in Gaza from time to time. The socio-economic situation is also impacting the malnutrition, and we have some forms of malnutrition that is registering kind of, improvement in different areas of the world. Actually, it's still deteriorating in Gaza when we talk about wasting and the stunting for children under 5. The psychosocial well-being and the gender-based violence, the mental health, been impacted by the ongoing closure, by the instability, the hostility, and the deteriorated economic status. In addition to that, the people with disability also have been neglected, and they even have very poor access to their basic needs. On the top of that, actually, and due to what I just mentioned about the deteriorated health situation and the lack of skills and the lack of essential medicines and supplies, there is always a need for referral out of Gaza. And before the Corona, before the pandemic and the closure of the crossings between Gaza and Egypt, and somehow with Israel as well, there was like 1,200 patients. They used to leave Gaza every month to be treated in West Bank and East Jerusalem hospitals. This number has, dropped actually to 700 in March. I mean, early in the year, in January, for example, and February, it was 1,200. With the pandemic now, in March, it dropped to around 700. In April, around 113 patients only. And in May, even this number was only 105 patients who've been able to cross out of Gaza to be treated in West Bank hospitals or East Jerusalem. With now the annexation and the suspension of coordination between the BA and Israel, there is nobody actually to coordinate for patients' permits from Gaza to leave Gaza. Given this permit regime, patient in Gaza, they cannot go to West Bank without permits, so they have to apply for permits, and there has to be a body for this. So it was the civil affair department that belonged to the Ministry of Health who used to coordinate on their behalf. So their work was suspended by the end of May. So one of the human rights organizations, Palestinian Center for Human Rights, have took that role for almost 2 weeks. And then they had to suspend this role actually, as they were not happy about that what the Israeli media announced, that this center is taking the role of the PA and coordinating on behalf of the patients. So since actually the 9th of June, there is nobody coordinating for patients in Gaza, and we have been monitoring actually a number of cases with the WHO who are critically ill, and they are in need actually for urgent referral for urgent surgeries and medical treatment out of Gaza. However, actually no one has stepped in actually to support these patients to receive or to access their treatment in the West Bank hospitals or in East Jerusalem. So in general, the current health situation within Gaza, the Minister of Health is taking the lead on this, and they run 13 hospitals. Their bed capacity 3,000 beds actually in all Gaza Strip. This is even including the beds with the NGO sectors. Since the start of the pandemic, actually, Corona, 72 cases were diagnosed in Gaza. Of these 45 people, they were recovered, and the 26 patients still actually in the field hospital, identified by the Ministry of Health to treat these patients. And the ministry, due to the lack of resources and the lack of preparedness for such pandemic, actually the Ministry of Health, with support from the Ministry of Interior in Gaza, they took precautionary measures to quarantine all the people, all those who come back to Gaza from Rafah crossing or through Erez. So they put these people in a quarantine center for 21 days. And they do the testing for these patients on the 4th day and the 21st day. They don't have any availability of additional testing actually to be conducted for people at the community level. So it's only the people in the quarantine centers. So far, around 11,700 tests was conducted only in all Gaza Strip for the people. And the Minister of Interior, with support from the Minister of Health, they were actually asking people and trying to raise awareness with support from some NGOs for people for social distancing and to stay home as much as possible. But this is actually, if we just realize the situation in Gaza, and now it's summertime, it's almost impossible actually to apply this, and people actually are hanging around, going out for shopping, and the concern actually is really big concern. If one case is detected at the community level, what's going to be the impact on the population, especially that the health system is not really prepared. In addition to that, the Minister of Health has assigned or designated a hospital to receive the corona cases, and they are working on a scenario that if an outbreak happens, so perhaps we'll have like 2,000 cases. out of these, they expect 5% to be critically ill. So they are talking about, 100 cases that need ventilators and need critical care. But unfortunately, in all Gaza Strip, we don't have this number of ventilators. In all hospitals, and the Ministry of Health hospitals, they only have 63 ventilators. So in this hospital, they are trying to allocate, 100 bed for critically ill patient if they were, if this happened. However, so far, even with support from WHO, with ICRC, they only managed to get 20 ventilators. Actually, 12 of these are new ones, and 8 they were like, out of order, and they tried to maintain them and move them to that hospital. The ICRC and WHO also, they are trying to support them to have a triage area, to have buffer zone area within that hospital, to install some containers to be used like separate rooms for the staff who will be working. They are working on a training their staff to be prepared for this, etc. But honestly, I've been in that hospital 2 weeks ago, and the situation is really very far from being prepared. So the concern is really, as I mentioned, it's too much, and even the Ministry of Health themselves, they are really concerned, and they are trying to do their best to minimize the cases, and to be only the ones who are between the ones who are in quarantine, not in the community level. So given this situation, actually there are some key challenges that the health system and the health situation within Gaza in order to manage a pandemic like the COVID-19. Actually, there is immediate need actually to support the human resources, to train them, have an extra teams actually to be prepared and to work, and to, because the plan for these people to work for 14 days and then to be in quarantine for another 14 days, there is a need for infection control supplies, there's infectants, personal protective equipment, etc. There is a need for ICU equipment. I mean, it's not only the ventilators, but even the ICU beds, the infusion pumps, infusion syringe pumps. I mean, all these monitors. I mean, all these items that really essential for ICU units. There is a lack of diagnostic kits, lab reagents, etc. MAP and WHO has been trying to work on this, and even our organization have intervened and tried to support some of these items. However, actually the gaps are really great, and it's far beyond what MAP and what other organizations has been doing. So as I mentioned, the immediate procurement and distribution of vital antiseptics and disinfectants are needed. More supplies of kits for diagnosis. Actually, international aid has to and should attempt actually to support sustainable development, given that the health care system within Gaza, actually, it was really collapsing even before the start of this situation. And even Israel, as an occupying power, they have a responsibility to ensure that these 2 million people in Gaza, they need, they have access to healthcare, especially under such circumstances. And on the top of that, also there is immediate, there is a need actually immediately to find a solution for patients who need to be referred out of Gaza. The patients who cannot access their treatment, they cannot have their surgeries, people with a brain tumor, people with acute leukemia, and people who need critical care that is not available in Gaza. So now the service for these people are completely suspended, and it seems like there is nothing happening. And I'm afraid if the situation continue like this, we will start hearing about people who will die actually given that their cases will be deteriorated and definitely will have impact on their ability to continue their lives. Yeah, that's what I wanted to highlight about Gaza. Sorry if I was talking beyond the time. Thank you.
I think you're muted, Stephen.
Sorry, did you couldn't hear me? I was just thanking you for that very comprehensive briefing. Could I bring our next speaker in, please? I don't know whether that's Laila or Abbas. Please just go ahead, whoever should go next. Thank you very much.
We'll go to Laila next. Thank you, Laila.
Thank you. And thank you for having me, such a lovely opportunity. And I wish we were talking about less heavy topic. And I gotta admit, every time I am in a similar setting, and this is the second time I hear you Fikr talking, and it gets me more scared about, actually, we live in Gaza, we live the crisis, we talk about the crisis, and it's really a place you don't want to get sick at all at. Fikr did a great presentation about the situation in Gaza, and I think one line that really describes what is happening now with the people is that half of the people are poor, the other half are trying to support them. Everyone is affected, everyone is in need for support. We have new phases of poverty and vulnerability that has been coming, especially in the last 2 years. We know how Gaza crisis is shaped by occupation, by political division, and by ongoing blockade. Some people like to describe the situation in Gaza as a series of unfortunate events, and we don't know when this series will be actually stopped. And it's not a pleasant situation, as you can imagine. Focusing more about the blockade and the imposed separation policy by the government of Israel, we have Gaza isolated for more than a decade from the other half of the country and from the world. We have people who haven't left Gaza for more than 13 years who were not able to access the West Bank, people who usually go to trade and move within the country. The separation policy consists of 2 ways, in and out. And because of that, we have more restrictions in movements and trade and goods access. And this, as you can imagine, have meant a deterioration of the economic situation. The economy has been described as in free fall, and this means increased level of unemployment, increased level of poverty. People who are in a normal setting of economy would be productive are now the new faces of poverty and vulnerability. Who are these people? They are graduates, young, healthy, educated graduates who are graduating immediately from the university into unemployment, and I would dare to say into poverty immediately. We are talking about farmers, fisher folks, and we are talking about even employees who can't cope with the changes in the socio-economic situation in the Strip. To give you one example of how the separation policy has affected the economy, we have a dual-use list policy imposed by the Israel as a punitive measure, where they prevent access to some materials essential for agricultural sector and for other economic sector. And also they are preventing the export of materials from Gaza. For example, we have the processed food items. Before 13 years, before the blockade, processed food items used to be sold from Gaza in Israeli and West Bank markets. We are talking about date paste, we are talking about cookies and potato chips, which is not typically part of the security narrative. And these are prevented to be sold in West Bank and Israel. And this is a big chunk of the economy being dumped in local market that is saturated even with materials coming from outside. And also farmers to complete the chain. We have Gaza is a very agricultural community with a great capital, human capital, great resources, great land, a great access to sea, but we don't have access to materials needed. We don't have access to fertilizers and other agricultural equipment. This have caused a 30% deterioration in the agricultural sector, both in West Bank and Gaza Strip. There is some usual imposed restrictions, and this list is used, the dual-use list that prevents access of materials in Gaza is used as a punitive measures for more than a decade. Now, when we talk about COVID and what is happening, as Fikr said, people in Gaza Strip can't afford social distancing. They are living in very dense area. People in camps can't social distance. They physically can. We have extended families living in the same household where you have the grandparents living with the parents and the children. We are talking about people who have to go outside to make sure that they have the next meal on their table, and they don't have access to regular water resources. They don't have access to hygiene materials. And if you ask a poor family to weigh their options, to pay their money, whatever money they have for meal or for hygiene, you will know where their choice will go. And this is the reality now. And even before COVID-19, what was the reality? These people couldn't afford to buy food or medicine on debt. Can you imagine that? They can't buy that on debt anymore. And this was one of the negative coping mechanisms in the last 2 years with the lack of cash injection in the economy. People can't pay for water, drinking water. They buy it in debt, and sometimes they are not allowed because the merchants know they can't pay back. And so the whole chain of the economy is affected. As I said, we have around 1.5 million people in Gaza who are in need for humanitarian assistance, and they are made aid dependent more than before. Even the response of COVID-19 is dependent in aid and donors. And this is what we don't want. What we want is we want a strong infrastructure, and we want independent resources so we can respond to these resources, to these shocks independently. Now, if I want to convey some of the messages out of what we have heard from me and Fikr, I think more than before, the message is that people in Gaza has been abandoned by many actors, including the international community. We have been abandoned for more than a decade, and every year we are forced to lose one of our basic rights. Every year we have to use the resilience in a very negative way to make sure that we are surviving, not living our dignified life. And Palestinians, even with the Trump peace plan, what we have felt more than before, that we are thirsty for justice. We are thirsty for a United States under the international agreements. We are thirsty to be part of a strong state where we can visit the other half of the country. And we are thirsty to trade within our own country. We need to end the blockade of Gaza. Blockade means the de-development state of Gaza Strip, de-development of one of the most rich and amazing people, human capital, who are forced to depend on aid. Israel has to recognize their occupying responsibilities under international law as the occupying power to help mitigate the crisis of COVID, but also to gradually remove the blockade and the measures imposed for separation to make sure we have recovery and sustainable development with our economy. Now, if I'm gonna tweak a little messages to you as well for you being in the UK has always been one of the major donors, especially for UNRWA, which is very much appreciated and very much needed. A donation that is really welcomed and still needed to support many sectors, including the health sector. And also we need to see more alignment of the UK, of the foreign policy, the UK foreign policy objectives and the international development objectives. This alignment means we have humanitarian intervention and intervention for economic recovery, but it should be sustainable economic recovery accompanied by political actions to ensure that we eliminate the root causes for a humanitarian crisis in Gaza. If we don't do that, we're still going to have the same situation, and the next crisis in 5, 3, 10 years, we will be sitting here saying the same messages. It's a humanitarian crisis in impact. It is a political situation in root causes, and this needs to be addressed. Because it's not addressed, we are here today talking about that. Simple messages about dignified life living in Gaza. Most importantly, we need to have a physical corridor between Gaza Strip, the West Bank and East Jerusalem. We need to end the fragmentation. We need to have a political unity, and we need to push into political reconciliation and ensure we have a unity government speaking on behalf of, speaking with the Palestinian people, but also aligned for their obligation toward the Palestinians in Gaza. We need to see more actions toward ending the dual-use list, and then the punitive measures on access and movement. We need to recover the economy. Basically, we need to go back to how the blockade was, but in a better way. And this is a stronger economy where we are not dependent on aid. And also we need to feel that we are supported by the economy, by the international community, who are supporting international law, supporting human rights, and supporting justice. And I would say my last message is to welcome you to visit Gaza. Sometimes now it's virtual, maybe. Next time, maybe we can host you in Gaza, West Bank, and East Jerusalem, and we are more than happy to have you and show you what we have been talking about. Thank you so much for listening, and hope if you have any questions, I think at the end we will be able to answer it.
Am I muted or no? I'm on. Thank you so much, Laila. That really did help to build on Fikr's presentation and give us an even more detailed picture. Now to our final speaker, please, Abbas. Thank you.
Yeah, thank you, Stephen, and thanks for organizing this meeting and for allowing me this opportunity to talk about it. My area of focus for this speech today will be on annexation and the impact of that annexation on people and on land. I'm not going to give that much details because I'm very much sure that you are aware of the situation here politically and the occupation. But I will, go over some slides just to give you a background info of how things and where things are going. And to start up with, let me say that annexation in Palestine have been undergoing since the past decades until now. It's not something new. However, the formal announcement of the annexation is that the thing that we are waiting to happen from the Israeli side by July 1st, or maybe it might be postponed. So I don't want people to be deceived if Israel on July 1st do not announce the annexation, because the annexation itself is undergoing and is happening on the ground. Land has been, shrinking day by day, and this has been ongoing since 1947, since the Nakba until now. The Israeli plans have been always to control and to expand on the Palestinian lands that is occupied and taken by them. And if you look at these four maps, I think it's not new maps to you, but look at the history of Palestinian loss of land since 1947 until now. The green areas in 1947 shows the Palestinian lands. The white areas were the Israeli-dominated areas. According to the UN resolution, partition of Palestine in 1947, 45% of the land was supposed to be an Arab or Palestinian land. 55% of that land, according to the UN resolution, was meant to be an Israeli state. Israel did not accept that plan at that time, and the state was established on 78% of the Palestinian Palestine of the mandate, remaining only 22% for Palestinian as an area we all know as 1967 land occupied after the Second War. Despite that, Israel continued its plans for expansion and eating up the land bit by bit, by expanding the settlements and by enclaving and isolating Palestinian communities from each another, to end up by a map, the fourth one, the present map you see, where you see Palestinian communities are completely segmented, isolated, enclaved, without any geographical community, without any geographical unity. And it's like small islands, swimming and floating in an Israeli-dominated sea. And no one can imagine how a viable Palestinian state can be established on a situation like this. The question, why Israel forced the situation and made the facts on the ground to make the situation on the ground look like this, is by encouraging settlements and providing incentives for settlements and for settlers to come and settle in Palestine on settlements. And this shows in slide 2, please. This shows on slide 2 how number of settlers in Palestine increased from 1970s until now. If we look back, and this curve up line shows the increasing number of settlers in Palestine since after the Second War in 1967 until now. In 1970s, number of settlers in Palestine was only 50,000 settlers, and that continued to be by the first Intifada. It reached up to 150,000 settlers. when Palestinians and Israelis started their talks, the peace talks in 1993, and when the agreement was signed in Oslo 1994, the number of settlers increased to 250. And by signing that agreement until now, what Israel needed from the Palestinian side is that they wanted time, which they gained by signing that peace agreement in 1994, and they released themselves from the pressure of the international community on the expansion of settlements. That's why number of settlers after signing the 1994 agreement until now has tripled. You know, the number of settlers we have now in West Bank reaches up to 600,000 settlers. And this number increased due to the incentives the government of Israel is providing for settlers and for settlements expansion in West Bank. You know, for settlers, they're receiving house allowances from their government. They are tax exempted, and they receive support for resilience from the government budget. This means that, I mean, Israel allocate 147 million shekels as support of resilience for settlers in West Bank monthly, on monthly basis. So, I mean, this is very good business. These are very good incentive package provided to settlers, and this encourages them to come, stay, live on the lands occupied and confiscated from Palestinians, using the natural resources, water, that are taken and confiscated from the Palestinian side. By this increased number of settlers made the situation on the ground by enclaving the Palestinian communities and disconnect them from their agricultural land and their resources. Next slide, please, Joseph. And you know, that agreement we signed, peace agreement that's signed, and you know, the categorization of the land, Area A and Area B and Area C, where Area C was under the full control of the Israelis. And just to give you some figures on this, you know, the entire area West Bank area is equals 5,628 square kilometer. Area C is almost 60% of the West Bank area, which equals like 3,377 square kilometer. Number of Area C Palestinian residents reached up to 300,000 people living in Area C. Number of settlers in Area C reached up to 500,000. Jordan Valley alone by itself, which forms like 29% of Area C, the area there is 1,620 square kilometer. Number of Palestinian residents in Jordan Valley alone is 65%, despite of all the restrictions of constructing and living there, because it's Area C under the full control of the Israelis in Jordan Valley. Number of settlers in Jordan Valley are 11,000 settlers there, and number of settlements there, those 11,000 settlers are living in 31 settlements in Jordan Valley. But they are occupying almost most of the Area C in Jordan Valley. Next slide, please. This is what, you know, I mean, we've been talking about this, the so-called deal of century and the new map for annexation, you know, and the deal of the century announced by Trump. Actually, it was an Israeli proposal, but Trump only announced that proposal to the public as if it is a U.S. Deal for peace. Look at, if you compare the Trump deal of century map with the 1967 map, you can see how the Palestinian communities and areas would look like. These small dark black spots are the Palestinian communities, you know, and the gray areas would be the Area C that Israel is now planning to announce formally the annexation of that area starting from July 1st or maybe the months to come. And all the gray areas where the rich resources are available have been entirely under the control of Israel and given for the benefit and the sake of settlers to use and to live from. Next slide, please. Now, the question, what does that annexation mean for people? what is the reflection of that annexation on people and on land. Israel, as I said in the beginning, the annexation itself has started years ago, but the formal announcement will be maybe is the thing we are all, concerned about in July or in the months to come. But if Israel announce formally and officially the annexation, this means that 29% of the entire Jordan Valley would be fully controlled by the Israelis. This will also mean controlling 51 residential areas in Tubas and Jericho areas in that Jordan Valley area. This will mean that West Bank will completely be separated from the Jordan, from Jordan. This will mean that full Israeli control of the Jordan Valley, which is one of the largest source of economic income and water resources. 95% of our water resources are existing in that area, in Jordan Valley area. And by the way, Jordan Valley area constitutes 50% of all agricultural lands. The most fertile soil, 50% of it, and 50% of the produce of agriculture is coming from Jordan Valley, which Israel is planning to annex as first phase of annexation in July 1st on the coming months. This means that mineral water and access to other natural resources, including Dead Sea area, will be completely blocked and under the full control of the Israeli. The entire Jordan Valley will be like a military zone area. An area dominated and controlled by military, and restrictions on access will be imposed on all farmers and who will be deprived the right to access their land and their water. And if access to land and water is restricted, then agriculture and food security by itself would be under risk and will collapse. The entire agricultural sector will collapse if the access to land and water, which are the main resources for farming and for agriculture, is restricted. Then the entire agricultural sector and food security in Palestine will collapse. Next slide, please. Now, the question, we have been witnessing these plans on the ground since, as I said, the past decades. And settlers have been encouraged to go and live and settle in West Bank and live on the lands that are owned by Palestinians. Why they were encouraged? Because of the incentives. The Israeli government is giving them incentives, and they have never been under pressure. They were never held accountable of being occupying powers and of being a government that gives incentives for settlers. The question, what should we do? I think although it is late, this is the time for all of us to stop talking but start doing. And I mean by start doing, by taking actions. And this is the time to shift from the level of condemnation and expressing concerns of what's happening in Palestine towards taking actions and imposing sanctions on the occupation and on settlers. And this is what we expect as Palestinian and as farmers from the international community to do. We would expect from UK to ban arms trade and military security cooperation with the Israeli government. There must be a price Israel should pay as an occupying power, and there must be a price for this continued occupation in Palestine. And the second would be, I would expect banning of settlement produce from accessing the UK markets. Those settlers who are living on Palestinian occupied lands and they're confiscating the water resources and they're producing agricultural produce, this produce should not have free access to market in UK and in other European countries. And I don't mean here labeling the agricultural produce of settlements. I mean banning entirely that produce from entering and accessing the UK and other European market. We would expect to suspend free trade agreements with Israel, so they feel that there is a price for what they do. All the trade relation with the Israeli settlements should be, stopped immediately. Settlers should feel that there is a price for being settlers, and that the incentives they receive, whether from their government or indirectly from the international community by opening their markets for this agricultural produce from settlers to increase their profits, should stop. immediately. And this is when we start doing something and taking up actions. I think there must be restrictive measures against individuals who are supporting settlement expansion and against those who are encouraging and giving incentives for settlers in West Bank should be also adopted by UK government and other European countries, and to apply the same foreign policy EU adopted when Crimea was also annexed and imposed annexation against the Crimea. We need same standards to be applied to the situation in Palestine with this annexation from the Israeli side. We would also expect that all individual and corporate actors responsible for war crimes in Palestine against the humanity in the context of the Israeli regime of the illegal occupation and apartheid are brought to justice. And believe me, guys, if there is no actions, serious actions taken against occupation, no serious actions taken against settlements, this occupation will continue. And that dream, what is remained from that dream or hopes of peace, agreement, and two-state solution will really evaporate. And this will mean a new uncertainty of a new era will start in this country. No one can predict where it will lead all of us. Hopefully, this is the time to do something and to take actions and to impose, sanctions on this apartheid regime in Israel, similar to the sanction and boycott that happened against the South African regime, apartheid regime in South Africa, which ended after a period of time to collapse, for that regime to collapse. And we all here hoping for this apartheid regime Israel imposed on us in Palestine, on the Palestinian occupied land in 1967 to end, but it will not end by hopes and by talks and by expressions of concerns. It will end only by imposing and taking serious actions and sanctions against Israel as an occupying power and against settlers who are stealing the land of farmers and the natural resources there. Thanks, and I'm ready to answer any questions you may have for this presentation.
Well, thank you very much to you, Abbas, and to all of our speakers. I'm going to have to jump off in about 5 minutes, unfortunately, because I've got to get on to something else that starts at 2 o'clock. So I open the floor to questions, and I'd suggest that if it's all right with you, Joe, I don't know how long people can stay, but if we can maybe run through till 2 o'clock and you can kind of chair it once I've jumped off. And I'd suggest maybe taking questions in groups of 3 because we don't have much time really. So probably needs to be a quick fire round of questions. And I think colleagues who do have questions, if you could keep them as short as possible, please, because we've got very little time left. Thank you. Do we have any questions at all?
First question.
Yes.
I'm sorry. Abbas has just talked about, adapting actions similar to those that were taken in South Africa in terms of boycotts and such like. However, BDS has been criticised by some people as being anti-Semitic, and it's about, how we deal with some of those accusations.
Yeah.
Yes, I know how sensitive talking about that BDS issue, but here let me distinguish between, delegitimizing Israel as a country and delegitimizing the occupation as an occupation. Occupation by all means, by international law, by humanitarian law, by even UK constitution. None of these countries are supporting the continuation of this occupation. And the sanctions and the punishment and the boycott should be on the occupation and on settlers. Settlers who are leaving their country in Tel Aviv and in Haifa and wherever and coming to live on the lands occupied and stolen from Palestinians. Those people should be punished. Those people should be brought to justice. Those people should feel that they are paying the price. And once you take sanctions against them, you're not taking sanctions against Israel as a country and against, Israeli citizens. You're taking, steps against the occupation as an occupation. That should end. And believe me, we have been under occupation since second occupation in 1967 until now, and nothing has stopped them from continuation of this occupation, because they have been coped with all the international community, you know, let's say, statements of concern and condemnation. The maximum of what the occupation would expect from the international community would be statement of concerns, and that never stopped them. This is the time to take sanctions against the occupation and the occupation practices in the occupied land. By doing this, it's not BDS, it's not, you know, it's not anti-Semitism, it's anti-occupation practices and anti-settlement expansion. Without actions, nothing will stop settlers from being settlers. Nothing will stop the greed of Israel to expand on Palestinian occupied land the way they are doing now.
Thank you, Abbas.
Thank you for that. Stephen's unfortunately had to jump off now, but I'll sort of take over for a little bit. We had actually a question from Baroness Sheehan, who's also had to jump off, but maybe we could answer that now. It's that obviously today there was an announcement from the Prime Minister that DFID will be abolished. What questions would you like the Prime Minister to answer about DFID's role in Palestine? Perhaps maybe all three of you have a short response to that, and then we can take some more questions.
Can I start? Oh, well, okay. You know, I had the chance to meet with DFID headquarters in London last year, actually, in our lobby trip there, when we met some parliamentarians. We were talking about restrictions on access of movement to land and to water resources. And what we asked them, actually, what we asked DFID to do, is to allocate more funding to support the steadfastness and the resilience of people who are under serious and direct threat in Jordan Valley and in Area C, by allocating more funds there. To be honest, the last project DFID funded for the agriculture sector in Palestine was in 2017, and then they stopped. And most of the fund now DFID is doing in Palestine is channelized through international agencies like the World Bank and UN agencies. What we in Palestine are expecting from DFID is to allocate funds and projects to support the steadfastness and resilience of people living in the Jordan Valley, providing them with the minimum requirement to stay in their land, protect their land from being annexed. Those people, if they are abandoned alone in Jordan Valley, they will be easy hunt for the Israeli plans of annexation. They will not be able to practice farming anymore. Most of their projects are destroyed by the Israeli army there in order to force them to leave their lands and to evacuate their land and emptify that land, agricultural area land in Jordan Valley, to make it as easy hunt and easy target for annexation and for confiscation. The response would be allocate funds for people there to make agricultural projects and stay in their land and secure income for themselves and for their families, which will encourage them to stay there. Settlers are receiving incentives from their government. Our government is unable to provide incentives for farmers in Jordan Valley because of the fiscal crisis they are under. But, you know, international agencies and donors can do something to support those people to stay there. And believe me, people will not leave their land, but they need some plans of backup, some plans of support, some, you know, some feelings of that they are not alone, that there are people in this world who care about them and who think about them and who can support them to stay there in their land and to secure funding from the agricultural produce they do from their lands and from their water resources, the remaining ones at least. If it should do something on this regard.
Thank you, Abbas. I think Laila, you have your hand raised. If you'd like to respond, that'd be great.
If I can take the liberty and say this, whenever we are writing a proposal for a project that supports vulnerable households, we talk about political division, occupation, we talk about conflict, fragile state, and then we started talking about US administration cuts to funds and not supporting humanitarian actions and development actions. We don't want to add another name to that. We don't have to increase the list that is already long. We are talking about cutting funds to basic services. We are talking about children not able to go to schools and receive quality education. We are talking about cutting basic health services for pregnant women who wants to make sure they deliver their babies into safety. And we are talking about people who are struggling to live daily basis and meet their daily needs. We need to talk about sustainable development, not shrinking funds. And this is the message I would love to leave you with it.
No, absolutely. I don't know if Fikr, you have any other comments or any concluding remarks as well. I think we'll probably be sort of wrapping up now as well. If there are no other sort of pressing questions from anybody else on the call.
Sorry, thank you. Actually, I just want to reiterate what Laila just said. Actually, in my presentation or in my brief, I mentioned, how the impact of the U.S. cut actually on UNRWA and the U.S. funded projects. And now when we talk about DFID as well, it's, we will be seeing really significant impact on the most vulnerable people actually within Gaza. And when we talk about the health system in particular, I know that DFID has been working with the Ministry of Health in Ramallah, supplying some essential items, and there was some good projects. Actually, MAP was one of the beneficiaries through UN organizations for some of the really valuable projects for Gaza, and just replacing, just thinking about how to replace, this fund and who can, support. It's really challenging nowadays. So it's not the time actually. And it will be never actually the time for it.
No, absolutely. Thank you, Fikr, for that. Kim, did you have one other question and then a comment from Shane?
I did, and I just wanted to thank all the speakers for their contributions. But my question is very simple: what can we do now and today? Because I'm a firm believer in actions speak louder than words. So while kids and people are dying in Palestine because of lack of food and medical treatment, what can we do?
No, and absolutely. I think that's the question I think we always have to ask our politicians and also as organisations as well. What can we do and how can we help? But Shane, do you want to make your comment first and then perhaps the
it's actually a little bit in response to Kim's question, really. I mean, if Abbas doesn't mind me saying, we had a meeting. So sorry, I introduced myself. I'm the country director for Oxfam and I'm based in East Jerusalem. So yeah, we had a meeting with Abbas and many of the other partner organisations for the West Bank. And if you don't mind me saying so, the partner organisations are a little bit jaded. This situation has continued year on year on year on year. It's deteriorated and got worse. And the expectation of the international community is very low because they haven't performed. Annexation is happening to draw. The land's been taken, the resources have been taken, their sanity, their hope has all been taken. So what do we need? We need the UK government to take the lead. It's very, very clear. There's a lot of very nice statements going out there that say we must do something, annexation is bad, we must come up with punitive measures, but no one is taking the lead, and we need the UK government to step up and spell out some of those measures that maybe Abbas already highlighted and say, if annexation happens, this will happen. And what I think you'll find is the progressive member states like Ireland and Belgium will step in line and be supportive, and you'll get some momentum going. But at the moment, because everybody's tentative and waiting for everybody else to do something, to say something, to commit something, Burrell is behind this. You can get member states to work, but the UK government must take the lead. And I would push the foreign minister, the foreign secretary to try and put something meaningful down in Parliament that people can get behind. Thank you.
Thanks, Shane. And absolutely. Do we have any final comments from our speakers on that point, on what we can be doing and what our politicians should be doing? And
yes, according to the peace agreement signed, none of each party, the Palestinians or Israelis, are allowed to take, to change facts on the ground. And Israel, by doing the annexation, is changing the entire, map of the whole area. And because they are taking these unilateral steps, I think they must be strong action from international community and from UK government. And on top of them, I would ask from the UK Parliament to vote for recognizing Palestine as a state under occupation. Why not doing that? I mean, Israel is changing the whole map here on the ground and nothing will stop them. Maybe a threat like this will make them think 100 times. And Israel has the right to be recognized as a state, similar to what the Irish Parliament did. They voted for recognizing Palestine as a state. And I think other parliaments in other European countries are studying this step, and hopefully we hope also from UK Parliament to vote for this. This will make Israel, pay the price of being occupiers, and this is the time for recognizing Palestine as a state. Second, we as a union, along with other representative bodies here in Palestine for agricultural sector, we announced Area C as a cluster for resilience. And we are now lobbying our government, our national government, to adopt the announcement of Jordan Valley as a cluster for resilience in order to encounter the annexation plans of the Israeli government. This means that all existing resources of our national government should be channelized towards supporting people in Jordan Valley in order to encounter the annexation plans of the Israelis. This is something that can be done also by international donors and agencies like DFID to channelize resources towards rescuing that area from being annexed and supporting the people there in order to enable them to encounter the annexation plans of the Israeli government. Although, as I said in the beginning, the annexation had already started. During the pandemic and the COVID-19, Israel intensified the annexation on the ground in Jordan Valley. They denied access of the grazing area. 40,000 dunums, the grazing area in Jordan Valley, have been denied access by small ruminants in Jordan Valley. 100,000 dunums have been completely restricted of any access by any farmer in Jordan Valley. This is even before they formally announced the annexation in July 1st. So the annexation is undergoing. So the action against that annexation should also have started.
Thank you, Abbas. Laila and Fikr, anything else to add?
Not much. For just one last thing, it's just international law and human rights applies everywhere and definitely applies in occupied Palestinian territory.
Thank you very much. And so thank you everyone for joining us this afternoon. And we have another APPG event next Monday with some Israeli perspectives actually on annexation. So I hope many of you will be able to join us for that as well. That's Monday at 1 o'clock. But we'll send details about that event also, and we'll also be sending a recording of this event. So if there were bits that you missed, then hopefully be able to catch up. But we as an organisation, also the APPG, are doing plenty of activity on annexation, more crucially, or more immediately rather, but also other issues related to Palestine as well. So we'll certainly keep you updated and continue to do that. But stay safe, and thanks very much again for joining us.